Dee Coley, registered nurse. Thank you for joining me today. I was inspired by seeing your post the other day of your husband. It's wonderful to see that he, it seems, has exceeded the prognosis that has been given by his doctors. And he installed a toilet the other day. How amazing is that? You know, stage 4 glioblastoma, and we'll get into that here in a second. But I wanted to bring you on to help to inspire others. We can't say that cannabis is the cure-all for all these different things, but we obviously need more human studies, and because it's such a challenge to get human studies approved by the federal government, this is my way of trying to get people's stories out. And even though it is anecdotal, it can give people hope, because over the years I've had many desperate patients call me, or loved ones of patients that have been diagnosed with cancer. And I can't say that there is a cure, but I can say that when I worked at the Bastyr Integrative Oncology Research Center, that the research that came from that, one of the studies, was a comparison between people that chose to just do conventional approaches and those that included naturopathic approaches. And it was found that people had improved quality of life when they included these holistic approaches. And you're a nurse, and you include holistic and naturopathic approaches in your practice and in your business. And so, later I want you to tell people the service that you offer. First, I guess we'll start, talking about your husband. And I guess before we go to that, let's talk real quick about Dr. Sue Sisley and all of the challenges that she had to get approved to do the PTSD veteran study using cannabis. So many hurdles and challenges that she had to go through, just to get access or have the federal government send her medical cannabis, which ended up being subpar, very old cannabis, that you would find much better quality just even from the black market. And so it's a shame to see that, these human studies using cannabis are forced to use the University of Kentucky's cannabis that they grow, and she has shown that it is subpar, and we need more human studies that are using quality cannabis for the different complaints. So I guess with that, we'll go on to about your husband. And there is a study out there about glioblastoma and using CBD, and that was promising. So I guess tell me about your husband, Bill, and when he was diagnosed, and more about that, please.
So he was diagnosed, well, he had his first, what he called an episode. He didn't really know what it was. And that was in September of 2018. And then in October, he had what we knew afterwards was a full left-sided focal seizure.
Okay.
It was odd that it was, he literally could feel all from the top of his head down to the bottom of his feet. The whole left side went numb. Mm-hmm. I immediately went into assessment for a stroke. Yes. Because that was, when someone does it like that, and he's left-handed. So that was his dominant side, made sense, but it was so quick. It was less than 2 minutes, and by the time I could even grab my phone to call the doctor, do anything, it was over. And he goes, "Well, that's over. Okay." And that was it. Well, that's a little weird, but so through that whole process, I remember telling them, he acted like it was a TIA, but it wasn't. There was something different. So it took us a long time. Sadly, glioblastoma patients, half of them are gone within the first 12 months.
Yes.
When they start having these things happen. It took us 6 months to get from our local hospital to Mayo Clinic and then to surgery.
Okay.
So, you know, he was already, you know, time was ticking very quickly, and he started having more and more seizures. So they diagnosed him with a grade 4, which in most all other cancers, it's staged, right? Depending on how, is it encapsulated, or is it spread, or is it metastasized to other places? And in a glioblastoma, there's no place for it to go. So it's graded by its level of aggressiveness, and the grade 4 is the highest. And so he was given the diagnosis of the most aggressive form of the most deadly of all cancers.
Yes.
And,
okay.
And basically it was when they went in to do the surgery, they said, there's no resection. It's too diffuse out into the brain, and to do anything would cause damage, and we would, irreparable damage. So they only got biopsies and said, we're going to do what we can, and we really want to focus on quality of life.
Yes.
And, we'll go as long as we can, and hopefully it'll, won't be too bad. I was like, no, that's just that's not working for me. Mm-hmm. And having seen, I started doing a deep dive, through that whole process, because there was speculation of what was going on through that whole 6 months. And I've always been that nurse that asks a lot of questions, and I'm always asking why. I'm not questioning you. I just have to understand why.
Right.
Because I didn't have to go to the patients, right, and say, this is why we're doing this, because I know they're going to ask me.
Yes.
So I started doing a deep dive into what the treatment options were and what else was out there. And I found a couple of things. One was, it's watching diet. I mean, it's not the full keto diet, although some have success with that.
Yes.
I would say you do you. If it works for you, great. I don't judge, but it wasn't something that seemed like it was going to work for us.
Okay. Yeah.
But it is a low processed foods, low sugars, trying to watch the sugars and the carbs and whatnot, lots of fresh vegetables and fruits and, clean meat.
Yes.
And we get it from a local farmer that we know. And then using supplements. It's called metabolic pathway blocking. And It is, we now have a group called Care Oncology Clinic here in the States.
Okay.
It's been here 4 or 5 years now, that have had great success. And it is an adjunct therapy. Some people will use it as an alternative, but it's a great adjunct to be able to use those plant-based supplements and getting good quality in there.
Yes.
The thing that gave the greatest promise was cannabis. When I kept looking at the reports, and it was like, THC, there's this attraction of THC with the cancer cells, that the cancer cells want it. THC goes in and it causes apoptosis, or cell death. But with our healthy brain cells, it doesn't do that. And it makes perfect sense to me, because we know how the cancer cells have gone rogue.
Yeah.
So his prognosis was really ugly. It was really hard for me to hear the doctor say even 2 years.
Yes.
That we might get 2 years out of this, and then we'll go from there. And I was like, well, we're already a year, we're already 6-9 months into this. So are you telling me that it's 2 years from now? Is it 2 years from the beginning? And then they don't want to have that conversation. I'm like, I know it's a hard conversation, but we have to have it.
Right.
So that's where I said, what, we're going to have to look at some other things. And so with cannabis, it didn't require, it doesn't require high doses. It doesn't require that you get high or anything like that. You can use tinctures. Yes, you can use whole flower. Not a big fan of inhalation. And if and this wasn't something that we felt like, maybe that'll change, maybe that point will come, but tinctures work great. And so we have just, incorporated these adjunct therapies to improve the quality of life, and to help make sure that quality is also quantity, because I'm a little selfish. I really like the guy.
Bless your heart, of course.
Who else gets up on a Sunday morning and puts in a toilet for you? Because the other one, we weren't liking it so well.
That is so great. That is so great. Yeah. And, with some of the patients that I've seen, they've had either, so in a way, I guess it has been fortunate that he didn't have a big surgery. Sometimes there can be personality changes, or also I know with the medications, some people get really agitated on those conventional medications that they use for it. So I wonder what other things, so we know didn't have a surgery, just a biopsy. Was there the chemo or radiation as well?
We did. We did the, it was 30 radiation treatments.
Okay.
And then from the day you start that radiation cycle, then you stay on a lower dose of chemo drugs. In his case, he used temozolomide throughout that chemo. And from that point, you come off of it for 23 days, and then you're on it for 5. And then you're back, and we call it a 23-5, because he's off of it 23 days, and then he's back on it for 5. And they do 12 rounds of that.
Okay.
So and some doctors, depending, every case is different, but in general, they'll either do 6 or 12, or until the patient can't tolerate it, or they try something else. In his case, he was able to do the radiation. He did the lower dose chemo, and then he did 12 cycles of the full strength of the temozolomide.
Okay.
And finished that up the beginning of June.
Okay.
And, each cycle gets harder and harder and harder, and you see the fatigue and when they talk about chemo brain, you see it.
Yes.
You cannot deny it. It is there, and when stuff is attacking the brain too, it's brutal.
Yeah.
But we've been very blessed that, we had a good doctor with that, great team that worked with him. We've seen the scans since, and you can tell the doctors had said there would be, don't expect any shrinkage. We're not going to get any shrinkage. We're just trying to ensure some quality of life kind of thing. And it's less dense, which they were a little hesitant at first to say. And I always laugh because my daughter went to a doctor's appointment with us, and she's a full adult. And she went in, and he says, here's the 2 comparisons. She goes, well, I can even tell with my untrained eyes that this thing is not looking the same as it did.
Excellent.
And he goes, okay, no, I can't deny it any longer. It is less dense. And that was great, but that's probably about all we're going to see. Okay, fine. Well, now we're seeing that there actually is a little bit of shrinkage to it. And, I believe everyone has their own person, their belief system and their universe. But, first I'll always give God the glory, because of the way the whole dynamics went, and getting us to the right doctors, and even changing surgery and changing our surgeon to someone who was one of the top 3, I think, in the country. It was just to the discovery of the plant, the whole process. But he's doing amazing.
Fantastic.
Yeah.
That is so
We're
wonderful.
coming up. September will be 2-year mark, and he is going strong. He is not stopping.
That is so great. Yeah. And it reminds me of, there was a time before the medical cannabis passed in November of 2018. I remember having a woman call me, and she had brain cancer and had a surgery done. And then she started using the Rick Simpson oil, and there was shrinkage, and she went back, for that imaging, and the doctor just said, I know there was something there, and he was just so surprised. And she was actually calling me to try to find a source for more Rick Simpson oil, and an affordable source, and that's another hard part is, it does take a lot of plant material to make that. And not everybody can afford it, but, there are kind people out there, such as Josh Loftus, that I, interviewed last week that, you know, helps to teach cancer patients how to make their own and that sort of thing. So were you using the, you know, Rick Simpson oil or FICO, the full extract cannabis oil?
Sorry.
No, that's okay.
We have gotten, we've been able to get plants to make tincture.
Yes.
From that, and been very cautious. You know, it is still, thank goodness Missouri passed, you know, the laws for us here. He has his medical card, so he is legit, but you know, he's also still working. And fortunately, we don't have to, you know, he doesn't have to travel or anything like that because of COVID. But we've made sure that what we've done has been really more on the very conservative aspect of it, but the tinctures seem to work the best.
Great. So yeah, so at this point you're saying you haven't been cooking with cannabis, maybe in the future, but right now you're using that extract of it.
Right. Right. Yeah, the cooking is I just haven't, well, I'm not a big cook anyway.
That's all right. Yeah.
You know, yeah, I don't cook. I can whip up some mean enchiladas and Spanish rice and, you know, some pastas, but I'm not a big cook. So I know I've got other people that have since come out and said, hey, how about we try and cook with this? I'm like, oh, all right, that's fine. It sounds more fun than painting by numbers or something.
Yeah. Well, good. So do you mind talking about the dosing that you guys have used?
The dosing, we really have, we started off, so we've got, you know, they do the ratios, right? But ultimately with those ratios, if you look at it closely, which I know we have to do so much work with the labeling, right? That's huge. But when you are doing the dosing, we always want to start at the lowest. And he was someone who's never used anything like this. So we started with really high CBD counts and very, very minimal on the THC. So like a 20-to-1 type scenario. And then even with that, it was still starting with a quarter of a dropper and then a half a dropper and one drop, you know, working the way up. Because with the seizures, we know that we have really good results with the CBD. And honestly, based on what I was seeing with the research, that, well, okay, if I can't knock out the tumor, then I can at least control the seizures better. And so he's on anti-seizure medications, but he is at the minimal dose. And he's never had to be on any steroids. And, you know, yeah, I mean, the things that so disrupt so many of the patients, he's not had to go through that. And the doctors have said, you know, the doctor always says, I don't know what you're doing. I know you're doing something else, but just keep doing it because it's working. You know, that's kind of the whole process that we go through that same conversation. But we started with that really the high CBD, very, very low THC. Okay. And then started bringing that CBD down where it was more of a 1-to-1. Okay. Mm-hmm. And that's where we've stuck with. But honestly, even the THC amounts, you know, if it's a Friday, Saturday night, you know, or if I know that he's starting to have problems, then we'll increase it. But really, honestly, anywhere from, you know, I think when we started, it was maybe 2 milligrams. Okay. And on the THC, we've gone up as high as 10 when he's had more problems. But that's really about as high as it's ever. He's gotten the symptom relief, you know, whatever's been going on, that's been controlled. And so I know from everything that I've learned that, you know, higher is not better, you know. Yeah. And there's a lot of discrepancy between the studies that we have, right? So we've been able to study rats, you know. I always say, you know, we have all these mice studies, but mice and men are really not the same. So where you give mice this ridiculous amount and you can shoot it straight into their brain. You can't do that with a banner.
Right.
You know,
Yeah.
we're not at that point. So how do we work through all of that? So it really is very, very low amounts. Does that work for everybody? No. I mean, I'd be a fool to say that, and it would be irresponsible to say that as well, because I know as a nurse that every patient is different. I always say the plant is diverse, unique, and individual, and it is just as much so as a person is. So when you put those two together, it's a different combination for everybody.
Yes. Yep. Some people feel they need higher doses. Yep. And so you have a company that is 2 Leaf Nurses. That's correct, right? Tell me the services that you provide.
Okay. The key with any kind of nursing is education. That's what nurses do more than anything else. Now, if you see them in the hospitals, you're not going to see as much of that teaching take place, but because it's procedure after procedure after procedure, and I've certainly done that, but we still have to teach. That is core. That's just a core piece for us, and we have to look at patients holistically. So when all of this took place, my whole focus was, I don't want to do anything nursing. I just want to be with my husband. I don't want to miss a minute with him, and I want to do everything I can for him.
Yes.
But there is a higher calling as a nurse, and as physicians, it is a calling in our hearts that we can't just shut down.
Yeah.
So I started, along with my business partner and longtime colleague, we started 2 Leaf Nurses to provide that education. We do education, advocacy, and collaboration. And so I always say education is key. And when you have that education, that empowers you to be your own advocate. Yes. And so I coach them along. When I'm telling them, I'm teaching them how their body's designed to work, what happens when it doesn't, and how then cannabis or any other therapeutics may or may not help them, because cannabis isn't a magic bullet. It's not a one size fits all. And some people, it's not appropriate for them. Just like some supplements are not appropriate for certain people. We have to look at the whole person. So we provide a ton of education, and we coach them through this journey so that they understand this is what I'm supposed to feel like. I kind of remember that, but not a lot, because there's so many complexities going on. And then we teach them what is happening with their bodies, with the endocannabinoid system, with their microbiome even. Sometimes we have to go into that. People don't understand that aspect. That gut-brain connection. Why are my moods all so out of whack? What's wrong with my head? Might not be your head.
Yep. The gut.
We're looking at those different things, and our lifestyles, our work environments, all of those things factor in. So as we're educating them, we're coaching them along, and so teaching them the different routes of administration. What is the cannabis plant? What is it about that plant? What's in there? People don't know endocannabinoids, right? So they're not going to know what a phytocannabinoid is. They certainly don't understand terpenes. And so until you start talking about roses and lilacs and citrus and pepper, and then they go, oh yeah, I know what that is. Okay, well, those things are in this plant too.
Isn't that amazing? Yeah.
We're walking them all the way through that process, so that once they're at the end of that time with us, then they are equipped. They understand their bodies. They understand the plant. They know what to look for and what to expect when they go into a dispensary, and what red flags to look for as well, and how to manage themselves to be empowered.
Fantastic.
So,
yeah.
That is probably I love being able to work with healthcare professionals.
Yeah.
As well. So, the patients are always those are my hot buttons. It's always about that patient and helping them. But we also work with healthcare professionals, because nurses actually 2 years ago, the National Council for the State Boards of Nursing came out and said, nurses, it doesn't matter what your level is, whether you're a student, an RN, an LPN, LVN, or an advanced practice, there's certain things about cannabis you have to know. You know, we expect you to know these 6 essential things. And most nurses don't know that. They're working for healthcare organizations where they're not allowed to really learn within that. And I understand what's going on, but I'm more than happy to be that person to teach them about it. And then we're also working with dispensaries, manufacturers, and cultivators, because that's a collaboration. You know, I take a patient and myself, and we're working, and we have to pull that physician in, right? Because anything that I teach them, they need to take that to their doctor, because it's, you know, you don't take my advice over a physician, never, ever. But it's a collaboration. It's where all parts are coming together. When it comes to our dispensaries, our manufacturers, and our cultivators, we need to know what our patients really need. What are our patients really responding to? You know, here in Missouri, you know, I mean, we're going to have flower out at some point, but what about then what, right? So if someone cannot or will not inhale, right? Then what are they going to do? Because we have to know, you know, not all patients are going to do that, and we'll get there. You know, I have no doubt we'll get there. It's just, it's that clunky wheel. It feels like still. It's not a you know, smooth old machine that's just smooth, you know, going along. But I think it's important that as nurses and physicians work with patients here in the state, that if we're seeing that certain things are working better for patients than others, we need to be in collaboration with our dispensaries and our manufacturers and our cultivators, so that they can be producing what our patients are responding so well to. Because, you know, it's not like you're going to walk in. Most patients are not going to walk in and go, well, so sell me something, you know. I hope they don't, but I'm afraid some of them will. And I want to make sure that they're safe. That's my number one thing, is always I want them to be safe, and second, I want them to be successful.
Yes, it's wonderful, the service that you're providing and educating, because, you know, if people did start with a higher dose, they could have very uncomfortable symptoms with that. You know, they could feel like they're on a roller coaster ride and, you know, can't get off. So, you know,
we have these qualifying conditions for the state, and they only require one, which is fine, but that doesn't mean that patient only has one condition. They usually have multiples, and our patients are so complex, and they have multiple medications that they're on. And so that's where that really has to be a come together with the physician. So the patient divulging information and being able to take that information and say, okay, so you're on, you know, antihypertensives. So here's what we need to understand about it. You have type 2 diabetes, and you're on, you know, medications for that. These are things that we have to understand. You're on anti-seizures. All of those different things that a patient would be on, we have to have that divulged so that we can make the best decisions, and they can go back to their doctors and say, hey, you know, this is the journey I want to go on, or, you know.
Yes, and monitoring, you know, certain parameters like their blood pressure and changes and things. Yeah.
Things with their, you know, if they're on Coumadin or something like that, you know, when they're those anticoagulants and what happens to it. So.
Yeah. It will be nice when the dispensaries are open, so that people can get their medicine. We are in that immaculate conception period where people are allowed to have it if they're medical patients. But it sure will be nice to have those products tested and made sure to be safe and all of that. Liked too on your website was about a service of providing potentially an on-site nurse at the dispensaries to help with education on the spot. Yeah.
So. Knowing that, you know, the regulations and stuff, the way everything was written out, nurses no healthcare provider is required to be on site. That's not a requirement. And the fact is that's an expense, right? I mean, there's no way to cut it. You're not going to find a lot of, there's not a lot of volunteer cannabis nurses out there. There's not a lot of cannabis nurses to begin with.
Yeah.
So being able to offer that so that the dispensaries can budget in and the patients can know that there will be somebody there, and then working with those individual dispensaries, how much time do you think you're going to need that nurse on staff versus, another dispensary if somebody's really, really busy, and they know that they've got busy times, where would be the best time to put that in? And then also offering to do some of those educational events with them.
Mm-hmm.
I learned a long time ago, coming from a dad who was an entrepreneur himself, and watching businesses fail and some succeed, and the ups and downs of that. One of the things that I learned was never immediately say no to an opportunity. Always be willing to have that conversation, and that's really how Two Leaf Nurses has blossomed out, is by having those conversations. This started I always felt like if I could draw a cartoon character of, you have that person that's thinking and there's that little bubble up over their head. I felt like I had about a dozen bubbles just floating around in my head, and not really knowing how all of that went together. And that's been going on for probably 5, 6, 7 years. Who knows? At some point you start forgetting about it. You just know that there's something out there. And the more I learned about the plants, and I learned about microbiome and the gut brain connections and whatnot, the more all of those things started kind of coming together. And that's really what happened with Two Leaf Nurses at a time when I really just wanted so bad to just sit there and stare at my husband and not miss a minute.
Yes.
I had to realize that there was something else that was going on. And so that's how we've kind of evolved, if you will, to, hey, if you got an idea that you want me to help you with, okay, well, we'll have a conversation about it.
Yeah.
But education was always my first passion.
Excellent. Yeah. And, so I wanted to speak about how not all doctors certify for medical cannabis, and the reason being that some of them are working under, federally funded, in federally funded hospitals. And so they're not going to be allowed to. And it's mainly the private practice doctors that are doing the medical certifications. And, this video is, going to be posted on the Missouri Cannabis Network page, and that's a good resource to find the medical cannabis doctors. I know you're in Springfield, Missouri, and Dr. Lisa Warwick is down near you, right? And so she's one of the favorites.
Because you got to go through all the roads, and it's a little windy road to get there. But yes, and everything down there looks wonderful, and she's been phenomenal.
Fantastic. Yep. So it'll be great when her Cassville dispensary opens up. And maybe could you share your website or any contact information if people want to reach out to you?
Yeah, so the website is www.2leafnurses with an S on the end.com.
All right.
We are also on Facebook, Instagram, and LinkedIn.
All right.
Two Leaf Nurses. And I think all of those you put I think you separated out, two space leaf space nurses.
Okay.
I am not a social media guru kind of person.
Just punch in Two Leaf Nurses and you'll find you guys.
Yeah, I'm like, surely if you type it all together and it doesn't come up, I promise you it's there.
Yeah.
You can reach us that way. We also have our phone number is 417-812-7676. And you can call, or you can leave a voicemail. You can send a message that way too. I think that's all of them. The only one I didn't get on was Twitter. I haven't figured Twitter out at all.
Yeah, it's all right. Can't do it all. I'm not on Twitter either. I mean, it's enough with Facebook.
Yeah, I could probably get myself in enough trouble without getting on there, and you know, tweeting something that makes me sound like a twit of some sort. So I'll just
yeah.
my losses.
Is there anything else that you would like to share to patients or researchers, medical professionals?
The biggest thing that I would say to anyone who is looking at cannabis as a part of their health journey is to treat it as a medicine and to get someone that understands medicine and understands cannabis and all of those pieces and parts that go together.
Yeah.
Get with them. It is an investment in your health to take that time and learn about it. You are going to reap far more rewards that way than by just walking in and going, I don't know, I'll just try this or I'll try that. We never want to do that. So and to that end, education for people who have loved ones who need cannabis. They need to be educated as well. So one of the fun things that I get to do is, you know, the ladies that want to get together, but they don't want anybody to know that they're getting together. That's fine. You can go ahead and have some pie and ice cream and we'll sit and we'll talk about, you know, it's just, start the talk, stop the stigma. I say that plenty of times a day.
Yeah.
That's what we have to do. And we have so many things that we can be talking about right now. And so many things that we can't do a whole lot about, but our health is one of them that we can take control of, and we can work together with our physicians to all of us get educated and get on a road to a healthier life.